So, I at first would like to thank you for this invitation and for the possibility to get our group presented here today in Abu Dhabi. And InVitaCare stands for Psychosomatic medical group, which has some very eager goals. And for sure you have to work for these goals, and therefore I want to give you some information about this group. Let's see how this works. Yeah. So we are an ambitious team. We have several principles which you will see later on, and we also have web and app-based tools to support this kind of psychosomatic health care. We planning in the moment day clinics as well as stationary clinic concept in Germany, in Bad Honnef. And we are also having a lot of diagnostic tools in different areas to get the first steps done the right way so that patients can be treated in a proper way. And last and not least, we developing real estate healthcare projects. This is our group. I don't want to now introduce everyone here, but I can only say that there are a lot of people and specialists in our group which are experts in their different areas. For example, Mr. Kramer, who will talk later on, unfortunately got sick and he is getting connected by video conferencing later on. And you see me here in the middle, and also Mr. Aufenberg, who is a marketing expert, and so on. Some other people from our group, which I only wanted to present you quickly so that you get a feeling that behind all these things are living people who are having different business experiences in the medical field or in the economic field or in the marketing field. Actually, today I want to say something about diagnostics, long COVID, and this theme, psychosomatic description. And for sure we see that for a lot of people we have different needs and different treatments, and we have to really see that when people come to you like to a doctor, we have to try to understand them in the beginning at first before you make fast solutions for treatments. And my specialty is a little bit similar, I guess, to Mr. Weber's profession. I'm a laboratory medicine physician, and I stay in my hometown is in nearby Düsseldorf, and for sure I had also this kind of experience with COVID. We have 65 people running there 24 hours a day with all the same problems you described here before. It's very interesting that I think all the labs learned in this very tough time to get better organized in digital processing. So that's also what I learned, or we learned in this time. So I actually coming from also the patient side, so that I've seen a lot of special cases where I think laboratory medicine is one important part to find more behind the curtain, because very often people run from one physician to the other, and sometimes they don't find really the cause for their problems. And I think that in the last 15 years I'm able to say that a lot of these kind of sicknesses and problems, laboratory medicine could really find a solution for these kind of problems. So coming back to the theme, for sure we have the typical laboratory testing with PCR. Some from you guys probably know that there are also antibody testing to see what kind of humoral efficiency you have regarding this COVID virus. But a lot of other testings are not very well known. I mean, especially to show you this here. Okay, but what you see here is the typical laboratory COVID, like blood count and so on, but which is not known in every kind of laboratory or by the physicians. That besides measuring antibodies, you can also do some very interesting other possibilities by trying to figure out perhaps why immune deficiency from a person is there or not. We have instruments where we can see closer to lymphocytes in vitro or in vivo, so that we can decide to see where the cause is, what caused the immune deficiency, and then we can make our treatments to this person different than only giving them always the vaccination or not knowing what's going on with these patients. For sure, these patients are most of the times immune deficient or chronic diseased patients. To make a little explanation to this COVID situation, we talk about persistently symptomatic things 8 weeks after the infection, and everything which is basically 12 weeks after the infection, we call it post-COVID syndrome. Interesting is that we have an estimated 15% of all COVID patients which have these kind of post-COVID problems. 15% is my understanding. I never thought that this number would be so high. And you see that you also have a lot of pre-existing psychosomatic complainants. What you see actually is that we see a lot of damages in the tissue. We see chronic immune dysregulation, and we also see hyperinflammation or autoimmunities. Dysregulation of the kidneys, and for sure other COVID side effects. Warnings are, I think everyone knows the warnings. What I didn't know that there's significant weight loss very often occurred to these kind of patients, and they have somatic or psychological findings. And here you can see that there are some the frequency of COVID symptoms, and you see that very often for sure you see headaches or smell disorders, fatigue syndromes, and but also very often, which is important in this kind of situation, the depressed mode. So the people are getting depressed by having this kind of isolation through COVID, being sick, being alone, are not able to see family and friends. And this is a very huge factor, which I think is sometimes underestimated in a dramatic way. And for sure, we're thinking about what is causing organ damages. And organ damages, for sure, like very often, is a multifactorial cause. So a lot of people think that the virus persists in a way that it can damage for a longer time. For sure as well, genetic factors of each individual. Hyperinflammation, which is for sure an immunology question, and autoimmune processing. Okay, fatigue is very often a situation where physicians are not getting or showing a reaction in the first moment because they think, oh, fatigue, you are fatigued, then sleep a little bit more or do something, but they don't relate it to COVID. And that's a big problem. The smelling and taste disorder, I think everyone knows. And as you having these kind of problems, you have to try really to train your smell instinct by certain ways to get this back after a while. Only a very small percentage are not getting these problems away anymore. The very big important is COVID, post-COVID situation is pneumological aspects. Also here 10 to 15% remain symptomatic after this acute phases of 3 months. And I think this is pretty dramatic when you hear these numbers, 15%. And the medicine has to really go forward to get these 15% down ASAP because it's unbelievable. We only describe, but we're having not the tools so far to do something faster. And this is, for me, not very nice to see. Cardiovascular problems as well, especially in the first 6 months. Also, the venous thrombosis here and ischemic strokes has to be announced here, a big theme. And then you have also pain in different ways which you are not relating to COVID. Then neurological aspects are a very huge theme, and you always have to, if you have signs like this, for sure you have to go to a specialist and you have to tell him that it is also or could be related to your basically COVID infection. So now what does it all have to do with psychological disorders or problems? For sure we want to always try to go through life in the best way, but not always it is possible for us. And people and patients who are coming to us physicians, we sometimes think, oh, he is strange, oh, he's very unnormal. And my understanding is that a lot of these people are talking absolutely, honestly, the right things, but we physicians are not understanding them. So, and you can see here what kind of problems, especially in this kind of time, is high or less high, and you see that depressions are related 25% to COVID, either infection or isolation. That is pretty high from my understanding. Okay, for sure you have always in this kind of psychosomatic view, you have to really differentiate between somatic problems and psychological causes. This is not easy, so you have to go to specialists who know what they're talking about and can better make diagnostics in front of before they decide this treatment or that treatment. And you have the possibility to make a lot of therapy things which not everyone knows. Relaxation therapies, rehabilitation, also to get a different view on things. So there are a lot of possibilities to get back on the way. So what I said before, take all these kind of problems serious. I think this is very important. Initiate the appropriate diagnostics and also therapy ways. And you see, in August 2020, how many people thought about, in this depression, about suiciding. I think this is it. I have to say thank you for listening, and I hope that we have a good time today. Thank you very much.